Hi guys, welcome to my videos. So guys, today in this video I'm gonna describe something really important. So watch it till the end. But before I start discussing, if you have not already subscribed to my channel, please go ahead and subscribe right now. And also I would like to clarify neither I am a decision maker nor I am a government body. Yeah. So this is view of a common man here in Canada. So guys, from last so many days and especially recently, there is a huge uproar about healthcare services in Canada. And it's not just about Ontario, Quebec, it's for the whole country. If you see, go anywhere and see the healthcare conditions, especially in the emergency rooms, the waiting times are too high. Like, especially in Nova Scotia, after a woman died because she waited 6 hours in the waiting room before anyone could even attend her, and then ultimately, like, she couldn't survive. So, this has created a huge uproar, and many similar stories from other places may come out. I don't know, like, because but they are telling it will come out, but I don't know. And people are complaining about large waiting time. Somebody who had to stay like 36 hours, like somebody is waiting for 36 hours in emergency room. So what is the fix for it and how we reached here? This is what I'm going to discuss in this video, so please watch it till the end. So guys, when it comes to fixing the situation, like, I think the first thing we need to do is to increase resources. When I say increasing resources, it doesn't mean building beds and machines. They need to be manned, right? So that means we need to do more hiring in the healthcare sectors. When it comes to healthcare, I know, like, the government has acknowledged shortage of workers across the country, but it's time to fill it and fill it aggressively. So what we can do here is, like, fill up internationally trained nurses, doctors, like, make the process simpler for them to get integrated so that they can help. Let's say if there are 10 foreign trained nurses, maybe they don't have Canadian qualification, but temporarily they can be allowed to work under one head nurse who is having Canadian qualification and license. She can at least direct, that will ease the work pressure, right? So these things should be in place. This is what I believe. Second, I would say is, like, uh, we need to analyze why emergency rooms are being overcrowded. So there are various reasons for it. First of all, during the pandemic, a lot of doctors stopped taking in-person appointments and they were doing virtual. Now, now this had forced many uh, patients, those who may not be in, like, severe emergency need, like, I may have a back pain or something, but it's maybe like getting worse. So if I have in-person healthcare, I can visit some clinic. But if I don't, where will I go? I'll go to emergency because there I can see in person. So these things, like, need to be addressed. I think more and more clinics, more and more doctors should start taking patients for in-person appointments. In Ontario, I think it's already in place with some restrictions, but other provinces can join in, and that will ease the pressure. Third thing is, like, that is related to this is, like, we need more doctors, more family physicians. A lot of people, those who don't have access to family physicians, end up going to emergency rooms. So if we can solve this problem, then some people can be avoided going to emergency rooms, because instead of going to emergency rooms, they can go to their family doctors and get the necessary test, assessment, specialized appointments. These things can be handled through that, right? So it will reduce the strain on this issue. Next, but that you may find it strange, but I believe that's the case. If you go to any pharmacy here in Ontario, you're going to find severe shortage of cough, cold, and other common medications. Well, these things need to be addressed. Let's say you have fever, right? And you have a medication. You take the medication, you bring it under control, and you're fine. You may think that, okay, I'm going to manage like this for a few days, and if things worsen, then I will seek medical attention and then I will uh, go to any healthcare facility. So if in your case, if it gets resolved with these over-the-counter medications, you are not gonna show up at any hospital, right? But imagine if medicines are not available and people are getting sick and sicker, then ultimately they will end up going to the emergency room, right? Because your body has a capacity. So this problem needs to be solved as well. We did see severe shortage of kids medication during the flu season, but now it has gone to adult over the counter medications too. So if we manage this situation, this will help. In Ontario, the government has taken a step where for 13 most common illness and like minor issues, government has allowed pharmacists to issue prescriptions. So similar things can be extended to other provinces too, so that lot of these people don't go up to hospitals and doctors. Instead, if their situation is minor, pharmacists can help them and get them prescriptions and other things. So this also helps, and I really appreciate the government of Ontario for taking such a step, because like some common things, when they can be managed at a pharmacy level, why people would need to go to hospitals and clinics for it? That's really important. So overall, if I summarize and one more point, guys, like before I end up, that is pay. So guys, let me tell you what happens. Those who are aware that there's an agreement between US, Canada, and Mexico. If you have a job offer, if you're a citizen, and if you have a job offer in these countries, you can go over there. So for nurses and other healthcare professionals, there is a severe demand in USA, where they get much higher pay, less taxes than Canada. So let's say if you are a Canadian citizen and if you have got the nursing license, then whatever you are making over here in Canada and paying taxes, paying higher taxes, if you get a better pay in USA and less taxes and less workload, then what would you prefer? You know the answer, right? So this is also hitting Canadian healthcare industry. So this is where government need to plan adequate plan. So that is why I'm saying that making foreign um trained healthcare professionals work in Canada is really important. We need to structure the process of getting them in Canada, so that they really contribute, and ultimately it saves people's life, because saving life, it's very important. So hopefully this happens like that. Another issue that recently has surfaced is shortage of ambulances, paramedics, and it is related to hospital waiting times as well. So these things need to be addressed. So I discussed my opinion about it. Thanks for watching this, guys. Please subscribe to the channel. Thank you.